It's great to be here. I'm excited to share this ongoing work. This work is joint with Dinesh Puranam, who is at University of Southern California, and Brinda Kadiali at Cornell University. So in this work, we examine whether vaccine conversations on Twitter became polarized uh, with COVID, with the pandemic. Okay, thank you. So, as we know, vaccine hesitancy is a big risk, is a big concern to global health. WHO mentioned it as one of the top 10 concerns. It's prevalent across countries, not just the United States. So we know that vaccine attitudes matter, right? What's especially alarming to health regulators is it's fueled by political polarization, right? So we know from studies that information spreads on social media rapidly, and that's why our interest is in examining how these conversations have evolved on Twitter, right? And why do we care about this as a phenomenon? It's because these conversations could potentially challenge and influence consumer choice and conversations around vaccines, right? It poses health concerns, not just for vaccines, but also routine immunizations, for example, for kids. So research has found that with vaccine hesitancy, routine immunizations also tend to suffer, right? And it also poses challenges to managers of adjacent industries. So when their drugs are being used for unintended purposes, that could have adverse effects for managers in adjacent industries as well. So as we think about monitoring and looking at vaccine conversations on Twitter, prior research has done health infovigilance on social media, looking at things like adverse drug events and nicotine addiction on Twitter. It's important to note that these are observational studies. They do not isolate causality, right? What I mean by that is there could be changes in discussions that are arising from things like changes in the platform itself, seasonality of the topics. Certain things become more popular at certain points of time, and other time and unit varying confounds that could be driving these changes. And therefore, we cannot attribute changes in health discussions to specific events, which is what regulators and managers care about, which is, did a certain event lead to a change? So to do this, we focus on causal infovigilance. What that means is we analyze vaccine discussions before and during COVID by political leaning of a set of users and compare them to a set of counterfactuals using synthetic controls, right? So we analyze two events, two specific major vaccine events in detail: the Pfizer vaccine efficacy results in November 2020, and then the J&J vaccine pause in April 2021, and to find out how large a window do managers and regulators have to influence consumer opinion, right? So I want to take a step here to discuss the identification strategy in a bit of detail, because this is key to our study, right? It's key for us to isolate causal effects. And therefore, what we observe in our data is vaccine discussions and discussions of other topics, and our objective is to construct a counterfactual, right? What that means is we want to look at the evolution of vaccine discussions in the absence of the pandemic, in the absence of the treatment. And this is where we have this identification issue, which is, unlike clinical trials and experimental studies, we cannot run randomized control trials. We cannot randomize people's exposure to the pandemic and to vaccine announcements and see how they respond differently. So that is a limitation that we have in this context, right? And therefore, we rely on methods from statistics and econometrics to to look at a quasi-experimental design, where we essentially compare vaccine discussions, vaccine tweets, which we consider as treated, to a counterfactual using control topics, other topics that users posted about, to be able to say once we've observed the differences in vaccine discussions before and after, what would have been the counterfactual for it to be essentially be able to look at that difference, that delta here. Right? That allows us to be able to say how much has the conversation changed because of the pandemic. Right? So we use non-COVID, non-political topics as controls in our subset of data. I'll get to this in the next few slides. But essentially what this approach allows us to do is to capture trends that are time specific and also platform trends and seasonality in the data to rule that out. Right? And we use a specific approach called the generalized synthetic controls that allows us to control for some unobservables in the data as well. So we explicitly model for latent factors that could be driving these conversations, and therefore we impute counterfactuals using this approach. Right? So because this is a key step in our analysis, we have to, of course, conduct careful placebo tests to see whether our controls are actually valid so that we have confidence in the set of the counterfactuals that we generate. So what does our data look like? We looked at Twitter conversations around vaccines, commonly used search terms, around the time period of January 2019 through December 2020, and identified users who posted at least twice about vaccines. Right? So this helps us narrow down to the set of users who had expressed some interest in vaccine. And for tractability, we then construct a random sample of users, 10,000 users, which are representative of vaccine discourse on Twitter. Right? So you see here, there are two lines. The blue line is the overall vaccine discussion on Twitter, all tweets, and then the red lines represents the sample scaled to be comparable. Right? So we can see this, our sample follows the overall trends very closely. That gives us confidence that this sample is representative of vaccine discussions on Twitter. Right? Now that we've analyzed these 10,000 set of users, we can collect their data, all their tweets that they posted, and this is critical because we want to construct what are the other topics that they're talking about, how did those conversations evolve as controls, right? And for each user, we see what kinds of tweets they liked, and based on leading political figures, we estimate their lean as left-leaning, right-leaning, or apolitical, based on the kinds of politicians' tweets that they liked. Right? So we use two set of text models to construct our measures. The first one is vaccine stance. What that means is when a user posts about vaccine, are they pro-vaccine or anti-vaccine? And to do this, we use a custom Roberta model, that's the transformer model, and we supplement it with users' political inclination to capitalize on the correlations of it might be that users' political inclination is correlated with their vaccine stance. So we account for that in our text model. Right? And we have an F1 score of 0.82, that the slight improvement over what we would get if we just were to use the text of the tweet data. The other piece is extracting other topics. So we know for our 10,000 set of users, what are the other topics that they discussed? What are the other tweets that they made? So to extract a set of topics that these users posted about, we use the tweets embeddings and essentially cluster them using lower dimensional representations from uniform manifold approximation and projection, and then applying a hierarchical density-based cluster. Right? So our approach, our data is short tweets. It's smaller text, so it's harder to cluster with other approaches. So that we found in our context that this approach works well. Right? So we find there's a large variety of discussion for our set of users, about 415 non-political, non-vaccine topics that vary from music, food, sports, and so on. There's a large discussion, and essentially we capitalize on this to be able to say what would be a good synthetic control for our vaccine discussion. Right? So the first set of results that I want to talk about a bit is the vaccine major events in our time period. These events serve as a lightning rod. So to just briefly describe them, the first one was the Pfizer vaccine efficacy announcement, when Pfizer on November 9th, 2020 announced its vaccine's efficacy. Right? So the idea is these events serve as a lightning rod to vaccine discussions, and managers and regulators have a short time window to influence discussions. It's salient in the minds of consumers. It's big news at that time. Can we see, did that lead to a change in discussions for pro and anti-vaccines? And here we do find, so you see here the blue line represents the time of announcement, November 9, and the 14 days after. And the red and the blue lines are pro and anti-vaccine discussions. So pro spiked significantly more than anti-vaccine, but this is true only on the day of the announcement. So it's a short-lived effect. For our left set of users, the left-leaning users, we find this effect is significant for 2 days after the announcement. But for apoliticals and right-leaning users, this is only on the day of announcement. And this just highlights that health regulators and managers have a very short window to react to such announcements, to essentially be able to influence conversations on Twitter. Right? We also looked at the J&J vaccine pause. When the J&J vaccine was paused in April 2021 for rare side effects. Here we find there was not a significant change in either the pro or the anti-vaccine discussions. This was a mixed news. On the one hand, it highlighted that science is working, but on the other hand, it could be viewed as a setback for vaccines as well. So here we find that anti-vaccines discussions did not increase on the right, but it was also a lost opportunity for pro-vaccine to highlight that the science is working on these vaccines. They found an adverse event, so this vaccine was paused at that time. Right? So these two events allow us to look at a narrow time window around vaccine discussions. We also look at the overall discussion of vaccines on Twitter for our time window from January 2019 through June 2021. And we consider the CDC's announcement of a COVID response as the treatment date. Right? So you see the line 0 here represents the CDC's announcement, and after that it's the post-pandemic period. Here we look at net vaccine discussion as a measure of polarization. What that means is we looked at pro-vaccine, net of anti-vaccine discussion to see in which way is the vaccine discussion tilting. And here we find that the orange lines that represent our observed data, these are significantly higher amongst left and apolitical users. Right? So what that means is our counterfactuals would have predicted about this much level of discussion. These are significantly higher than what we've observed. So what that means is we did see a significant increase in net vaccine discussions on the left and apolitical users. Right? When we look at the right users, that's this bottom right chart here, what we find is that it's not significantly different from its counterfactual. It did not change. It did not change as much as compared to what it would have in the absence of the pandemic. What that means is that this is potentially an area of concern for policymakers and vaccine managers for this no change of net vaccine amongst right users. So to conclude here, what are some of the implications of our study? For managers, what we find is that apoliticals could be a potential conduit for communications. Other studies have found that being exposed to different views leads to users being more dug into conversations. So apoliticals could be a potential conduit. For regulators, we find that net vaccine, that's the net of pro and anti, that discussion increased among left and apolitical users. So that's likely sign of lower polarization. No change for right-leaning users is potentially concerning. What's also encouraging for health regulators is that apoliticals share in vaccine discourse increased. Right? And from a vaccine news perspective, we find that Twitter is a point of influence. It has a narrow, short time window where managers can influence conversations. J&J, we find mixed results. On the one hand, it was a lost opportunity to highlight the process of science working on the pro-vaccine side, but on the anti-vaccine side, we didn't see an increase, so that's the other side of it. Right? So that's all I had. Thank you.
Thank you. Right, we're running a little behind, so any quick questions before we move on? Okay, sure.
Hi. So this is really fascinating stuff. Just the quick question is, pre-pandemic, the question about vaccines and anti-vaccine involves childhood vaccination, but a lot of the discussion as the pandemic rolled in is about adult vaccination. Is your initial data stratified along these two lines?
So we look at vaccine discussions overall. We don't stratify at adult and child, but given that our analysis is comparing across political leanings, we'd expect that to essentially, in some sense, cancel out because we are comparing across all groups also.
Was Twitter your only source of information? Did you look at other social media? Another quick question is, Twitter is also infiltrated with many bots, so were you able to sort those out as well?
So Twitter is the only social media that we used, right? As researchers, we had access to this publicly available data. Of course, as regulators can have access to larger data sets, and they can compare that. But for our study, what we argue is that Twitter is a point of public discourse, right? So it's important to monitor discussions there because they influence consumer opinions, right? And on the question of bots, I think in our data we looked at, so we categorized users into political groups. So bots, we don't explicitly net them out, but because we are comparing pro and anti also, that effect should, in our counterfactuals, should get canceled out.
All right, thank you, Dr. Anand.
Thank you.